Switch gears a little bit for you now. President Obama and Democrats in the House making a last-minute plea to secure votes for their health care overhaul. Here's how Nancy Pelosi thinks.
Anything you need to know about the difference between the Democratic bill and the Republican bill is that the Republicans do not end health insurance companies' discrimination against people with pre-existing conditions. And let that stand. That's scandalous.
For a fair and balanced debate, let's turn to Republican Mike Pence out of Indiana and Debbie Wasserman Schultz, a Democrat from Florida. Good morning to both of you.
Good morning, Gretchen.
Good morning.
Morning.
All right, Congresswoman Schultz, let me start with you because the first question out of the box has got to be whether or not you have enough votes to pass this thing on Saturday.
Well, when we vote tomorrow in the late afternoon, early evening, we expect that we will have the votes, yes. And that's because we have a comprehensive plan that covers 96% of the American people, including 46 million who don't have health insurance. We make sure that we stabilize and secure the insurance coverage that folks do have and also begin to bring down costs. Unfortunately, the Republican plan only covers about 3 million people and refuses to protect people who have pre-existing conditions. And it really shows the difference in the priorities between Democrats and Republicans. Democrats care about health care reform. Republicans essentially don't.
Congressman Pence?
Well, I think what Debbie just told you is they don't have the votes. She said she expects to have the votes tomorrow, and I think the millions of Americans that are looking in this morning ought to know now is the time to let your voice be heard. You know, the Speaker said it was scandalous some interpretation of the Republican plan, which I'm happy to talk about. We actually do deal with pre-existing conditions in our bill, but what's scandalous is the Democrats launching a massive, $1.2 trillion government takeover of health care, paid for with more than $700 billion in tax increases on individuals and small businesses at a time that unemployment may well today come close to 10%. You know, we ought to be taking a half step back, working to lower the cost of health insurance for working families and small businesses. The Republicans are going to focus on a plan that talks about lowering costs and lowering the deficit, and also focusing on the kind of reforms that will get this economy moving again.
I got to get this question into Congresswoman Schultz, because after the elections on Tuesday night, did Democrats at all take that as any referendum against the spending of this health care plan? And number two, what about all the people who showed up on Capitol Hill yesterday, as well as half of the American public who appear to be against this type of health care reform?
On the contrary, in the elections that actually focused on national issues, the two special congressional elections that we had, one in California, one in New York, the New York 23 congressional seat hasn't had a Democrat represented in 150 years, and Bill Owens, the member who will be sworn in today on the House floor as a Democrat, ran on health care reform. Congressman Garamendi, who was sworn in yesterday from California, he ran on health care reform.
Okay.
When the American people are asked as voters to focus on health care reform, they support Democratic candidates who support comprehensive health care reform.
Okay.
The Republicans have nothing in the way of comprehensive coverage.
Unfortunately, Congressman Pence, I can't let you respond to that. I owe you for next time. I got to wrap it up with the breaking news today. Thank you to both of you.
Thank you.
You.
Coming up, we go inside the mind of the suspected Fort Hood shooter with a criminal